I can get the share back on. Well, doesn't seem to want to do share.
We can all see your screen, Maureen.
Yeah,
we can see it, Maureen. So as long as you can scroll through it,
You
can see it.
Start it in slideshow mode.
It should.
Start to
well,
run.
I can't see my slides now.
Oh no!
Oh no! What?
It says I'm sharing. Yeah.
You are. Yeah, we can see
Keep
it.
on playing around with your
Oh, there we
your
go.
view.
There we go.
Jolly good. Okay.
Don't panic. Right. Okay. Fine. Lovely. Anyway, so welcome everybody. So talking about metaphor and creativity. Now, this is to start with a little video about using metaphor for children who have to undergo lots of procedures, children with cancers and complicated diagnoses and that kind of thing. And of course, there's a huge amount of suffering involved. Children already feeling bad because they've got whatever illness they have, and then they have to have drips and bloods and injections, that kind of stuff. So this is a thing called the magic glove. Some of you may be familiar with it. And I'm just going to start. I'm not going to show you the whole thing because it's quite long. It's about 10 minutes.
Had a lot of needles in different places. Okay. We are going to use the magic glove because it's a wonderful way to protect your hand or your arm or your shoulder or wherever you need it so that you can feel safe. And the thing about the magic glove, it's whenever you need it, here it is. So I am going to put it on this hand. Thanks, honey. And you just relax.
People hear that okay?
Concentrate. Because as this glove goes on, it protects your hand so that you know what's going on, but you're not bothered. And here we go. We're putting it on the little finger. And as I put it on, I snug it up on the finger and then I make sure it goes right the way up. And this one, can you feel how nice that is? As the magic glove goes on, it's protecting your hand, Jazzy. There, honey, that's right. Over your thumb. Let's just make sure it's on really nice. And take a look up to here, but in a moment I'm going to take it higher. First of all, I would like you to feel the difference, okay? This hand doesn't have the magic glove, right? So I'm taking the pencil and let's test this one. 1, 2, 3. That's full feeling, 10 out of 10. Will probably be different because the magic glove is on. Oh, goodness. I didn't feel anything. That's marvelous. Now, Jazzy, let's put the number to this. If this is 10, I'll just touch you once. What is this one? If 10 is full feeling and 0 is no feeling and 5 is half, if that is 10, what do you think this is? How does this feel? Two. That's magnificent. Now that the glove is working so beautifully and we only took it up to here, let's take it to be a beautiful long glove all the way up to here. More like those evening gloves. We reason doing that is sometimes you have blood work there, right? And so you can feel my hand is making sure that that little corner gets covered beautifully by the glove. Oh, Jazzy, you're concentrating so beautifully. Can you feel how? Yes, the glove is protecting you so that you know what's going on, but you're not bothered. I'm going to do a trick because sometimes you also have injections here, right? Now that the magic glove is on, and it only needed to be here. For this, we're going to transfer the numbness, the good feeling, the safe protection to this part. Let's make sure it's right over that muscle. This is where the muscle is, hon. So put your arm a bit further down. That's it. Now concentrate and transfer. That's it. All of the protection, safe, good feeling to the top of your arm, so that if you have any procedure or needle there, you know that it's safe, 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 and protected. And you just tell me, nod your head when it's done. Wonderful job, Jazzy. Here I go. No. I know. That's 10. What is this? Probably about 10. Wow. You're so good at this. I think you could even bring it down further. Would you like to bring it down further? Take this magic glove. It's still on this hand. And before you reverse, there you go. Put it back here. Concentrate again. You did so well. Just send that.
Okay, so that is a technique that's used for children going through painful procedures, procedural pain. And I mean, it's all hypnotic suggestion. And children are very good at this stuff. I think they used Magic Glove between age 3 and 11. Seems to work quite well. And, you know, go to the dentist. You can transfer the numbness to the inside of the mouth, or, you know, if the child's having a drip put up, it's useful. But anyway, so the power of words. I mean, she's just talking. It's not magic. It's not some fancy, well, it is a bit magic, but it's not some fancy drug, and it's not some fancy nerve block or any of that stuff. It's just talking. And we know the power in words is huge. And we know about nocebo and placebo. Of course you do. But an awful lot of damage is done by medics saying really the wrong things, taking, you know, choosing all the wrong words, and you know, giving people horrible hang-ups about what's going on in their body. Saying your knee is bone on bone, I mean, really doesn't help the patient. And when you know, I have heard orthopedic surgeons saying to a patient of mine, you know, your backbone is crumbling, you know, some poor thing with osteoporosis, you know, don't say that. And telling them that the pain's going to get worse, you know, this is going to be progressive. Well, it's not going to help the patient if you say that. You know, you can say it. I think one of the reasons, one of my rather cynical reasons, is that the medic has got fed up with this patient and really doesn't want them to come back. And so they're lowering your expectations. So, you know, just get out of my clinic kind of stuff. Saying that there's nothing more that can be done for you is just totally wrong and dangerous. And then when you go for your flu vaccine and they say sharp scratch, they all say it. I mean, somebody's told them to say that. You just say, I'm just going to give you the vaccine now. I'm going to, you know, if it's an injection with some local, just say, I'm going to give you the local. You don't have to say, I'm going to stick a needle in your body. You know, it's just the wrong thing. And of course, giving somebody your undivided attention is a huge placebo. And just say things like, let's explore ways to ease your pain. You know, it can be done. And if you say, you know, to somebody your backbone's crumbling, you know, they're going to think it's just a pile of biscuits and they won't move. And of course, we know that not moving is one of the worst things for somebody with chronic back pain. So then you've got the thing about patients will always use metaphors quite often. You know, burning pain, sharp knife, electric shocks down my leg. You know, people have got neuropathic pain. They talk about electricity, a heavy stone, tight knot, crushing. You know, they gift you these words, but all we're doing is just saying, well, yeah, well, apart from all that, how bad is it? You know, give us a number. But of course, people think in metaphors, they imagine in imagery. And it's a gift, you know, you can work with that. So, you know, just start thinking about it. So you can get the person to actually describe the pain, apart from the severity. You can say, well, what colour is it? And do you know, whenever I've asked somebody the colour of the pain, you'd think, oh, you know, don't be stupid. Pain hasn't got a colour. But they all know the colour. They all know the colour of their pain. You know, what's the temperature of your pain? And it won't necessarily be what you think it would be. You know, we think, oh, well, pain is hot. But it might be cold. It might be icy. It might be the texture, it might be hard, or it might be like a big sponge, or you can't know, but the patient will know. So you can ask them. You don't have to ask all of these things. I mean, normally I would go for colour and temperature and texture, and sometimes about the surface. You know, is it shiny and hard, or is it fuzzy? So it will have its own characteristics, and they'll know what it is. And then once you've made a little list of what the characteristics of their pain are, you can then start to talk about what would this characteristic need to change to in order for you to be a bit more comfortable. And it might be pink, or it might be green, it might be anything, and you don't know what it would need to be in order for it to become more comfortable. It won't necessarily be what you think. And if the pain is hot, what would it need to change to be more comfy? What's the texture? Hard or soft? What would you prefer? If it's like electric shocks, how might that change to be more comfortable? So, and people who tell you, though, I haven't got very good imagination, within a heartbeat, they've got quite an elaborate story to tell you in images. And of course, this is where we go with hypnosis. So, you know, it's a very simple procedure. People see it as rather weird and wonderful, but, you know, just get the patient to close their eyes and find your perfect place of peace. So take yourself to a perfect place. So you can suggest you can have a beach or a garden, or you can be floating on a river. You can be anywhere you like. So you can get them to choose initially what the place of peace would be like, so that you've got a rough idea of where they want to be. And then you do a brief induction of trance. So one common one is progressive muscular relaxation. Now, I hope I know a lot of people already in the group here know about hypnosis, and they, you know, this is old hat to them. But progressive muscular relaxation, you just say something like, I'd just like to consider the muscles in your toes and in your feet, and just feel them softening and relaxing and easing. And that lovely relaxed feeling is spreading up the legs and through the knee joints and up into the thigh muscles. And you just talk them through all the muscle groups very slowly and laboriously in a nice, slow, quiet voice. And you feel this lovely sensation spreading all the way up the back and down the arms and into the tummy. And anyway, so you get the gist of it. And then you can get them to take themselves to their garden or the beach, where they will be completely safe. They'll be on their own, but they'll be very safe and be in that totally perfect place. So it might be a garden. Quite a lot of people like gardens. And when you're in your nice, perfect place, you will feel so relaxed, more relaxed than you've ever been, totally at peace in your perfect place. And we know that the more people relax, the more powerful your suggestions will be. So that's a given, really. Of course, before you do any of this, you've got to build rapport, you've got to know them a little bit, you've got to have that trust. Trust seems to be the most important thing. And a little bit of, just making them feel comfortable with you, explaining a few things beforehand. This is a very brief intro, I'm afraid. People who don't know much about hypnosis, I'm sorry if this is a bit too simplified. But building trust, getting rapport, and acknowledging that the more relaxed they are, the more powerful the suggestions will work. So once you've got them into a nice relaxed place, you can do some deepening. So get them even more relaxed than they were before. So you can make suggestions. So, you might notice this gentle breeze on your face. And as you notice the breeze just blowing gently, you feel even more deeply relaxed. And you might be walking around your lovely garden, and with every step, feeling the softness of the grass. So you get it to be quite sort of very vivid in their heads, get them to be in there and experiencing it, noticing the sensations and maybe the warmth of the skin, warmth of the sun on the skin, and more at ease, more relaxed, more calm. So you just do repeating and gently taking them into a nice deep state. And then breathing, of course, as they relax, the breathing gets slower. And you can suggest that with every breath you take, you're breathing in comfort and breathing any discomfort out with every out breath. And you may be surprised that it's so much easier now to simply focus on relaxation and comfort. So much easier to enjoy the relaxing, peaceful comfort of each breath. So simple, so natural to just attend to your breathing. So it's all just sort of repetitive, gentle speech. And now you've got them into a nice relaxed place. They're in their garden, they're lounging around there, feeling really calm and at peace with themselves. There's another thing that I haven't put in there called ego strengthening, where you can make suggestions that they're feeling really good about themselves and really confident, and a nice sense of inner strength, because that will enhance the outcomes to some extent if they're feeling really positive and certain about things. And now I'd like you to consider the discomfort you've been having. I tend to avoid using the word pain because it tends to kind of bring them up short a little bit if they get the word pain in the head. So the discomfort is more of a euphemistic term. So I'd like you now to consider the discomfort you've been having. Notice the colour. And they've already told you what colour. And they've already told you what colour they would like it to be instead. So you can say, notice that colour. I wonder what it might be like if the colour is changing to something more comfortable for you. And every so often you'll say something like, oh, that's right, very good. And you let them think about that for a little while. So you're not rushing through this. So you leave that on the back burner. And then you say, now I'm just wondering what temperature it is and how that could be changing to a more comfortable temperature. And if they've told you that the pain is a hard pain, you can say, well, I wonder if it's softening a little bit and changing. As you relax there, you can notice all these lovely changes are taking place. And as these changes are happening, this is a post-hypnotic suggestion. So you can say, you make a suggestion that these changes will continue once you've left the session and they're out in their normal lives again. So you find day by day you're more and more relaxed, because we know that anxiety aggravates pain. The more anxious, more depressed people are, the more likely they are to be suffering with their pain. So the changes continue to happen without you having to do anything. That's quite nice, because most people are a bit lazy, so they hope that they've started the wheels in motion. They don't really have to do very much. And you can say something like, you can sort of just notice it in the background, but you don't have to really make too much effort now that you've set those wheels in motion. And while they're in their trance, you might not do this all in the one session. you can teach them how to do their own relaxation at home, so their own self-hypnosis. So it's quite important to empower the patient, make it so that they can take charge of all of this. So you can say something like, whenever you wish to practice your relaxation, all you have to do is find a comfy position, relax all the muscles, starting with your toes. So you can teach them that as they've done in that session, you start with the toes and work all the way up to the top of the head. And take yourself to your garden and relax in the garden, maybe walk around in the sunshine, maybe sit down on the grass or lie on a sun lounger. I mean, they can have anything they want in this fantasy place. The more you practice your self-hypnosis, the more easily you can relax. So you put in all these suggestions that they can practice. Of course, obviously, if they practice more, they will get better at it. And the more easily you can relax and the more easily you can manage any discomfort that you may have. So that's quite a powerful tool to teach them. And anchoring is quite a nice little trick you can teach them when they're in their nice, deeply relaxed and receiving suggestions. You can say that a simple gesture such as touching the tips of your fingers and thumbs together. When you're so deeply relaxed, all you have to do is just touch the tips of fingers and thumbs together, and you will immediately become as relaxed as you are now in your lovely garden. So they can use that as a quick fix. If they're getting anxious, they're standing at a bus stop and they're feeling a bit tense, you can just say, they can just do their little trick. And the more they practice that, the better. And when they do it, when they're really relaxed in their nice self-hypnosis, it enhances the effect of it when they do it, when they're not there, if you get my drift. So there are various other metaphors. There's quite a commonly used one called the control room. So I'd like you to shrink yourself down and go into the control room inside your head. And in here, you can move around and find the screen where you find there is one main control managing the levels of your discomfort. Now, in the olden days, we used to say it was a dial with numbers on, but now nobody has dials and knobs. So it's got to be a screen with a control and whatever their control they imagine it to be. And you can play with the control. You can move it up and you can move the discomfort down. And that's quite illuminating because they realize that they're in control of it. I mean, it's a bit, again, counterintuitive to tell them to turn the thing up, and some people don't do that. But just move it down. You won't be able to say, you can move it down to 0 because it just becomes unlikely and they will just reject that because it's a bit too ambitious. So you can just say, just turn it down to what level seems appropriate. And people kind of know how to do that. It's amazing how they can use their creative mind to manage all that. Another very interesting patient I had suffered a partial amputation of the left hand in an apple sorting machine. And she had chronic pain in the missing part of the hand. She'd lost the thumb and the index finger. And she had to have a big skin graft put on. And I remember her telling me when she was in the hospital and they put the graft on, the graft filled up with blood. And of course, that was going to cause complete failure of the graft. Excuse me. So they brought in the nurse came in with some leeches in a dish. And the nurse could hardly bear it and was sort of holding the dish at a complete arm's length. Anyway, my patient grabbed the thing and stuck the leeches on. They sucked all the blood out and the graft took and it was completely successful. Anyway, her job had been to design and create amazing jumpers and cardigans and things. And of course, she couldn't do that anymore. And she was on a lot of analgesics, and this had gone on for months. But she was a very creative person and she had good ideas about what would work for her. And we didn't get too far into what the nature of the pain was because I sort of thought, well, I wondered what would help you. What would I call it the immune system, but I mean, it's just to give it a name to refer to. What would your immune system have to do to ease the pain? And she immediately came up with blue liquid pouring out from the top of her head, flowing down all the way down over her, covering her whole body, including going over the hand. And it would be cooling, soothing, easing. These were the words she and I we kicked around a few descriptions of it. And she was very easy patient. She was a very good hypnotic subject. And I did a number of sessions for her because I thought, going to need to really embed this because it seems like quite a challenge. And anyway, I can't remember. I think it was about 6 or 7 sessions, and I recorded the sessions. And it just got a lot better. It didn't go down to 0, but she did come off all the medication. And 2 years later, she came in. I mean, I discharged at that point. You don't keep going. I suppose I could have rung her up, see how she was. Anyway, she came in with a cough, and she was almost pain-free, and she'd retrained as a psychological counsellor. And she said it was a much more interesting job than sitting on her own knitting. And madly, she said the accident was the best thing that ever happened to her. I think I mean, that's a bit extreme, but that is what she said. And I had another lady who had post-herpetic neuralgia. So I don't know if people are familiar with shingles. Shingles usually just comes up as a horrible rash. It's usually one side of the body or the other. And it usually just goes away again. But sometimes it leaves you with a chronic pain. It's a neurological pain, which is a horrible, sharp, nasty, jabby thing and makes the skin quite sensitive. And this had been going on for 3 years, the right side of her chest. It went from the middle at the front all the way around to the middle at the back. And she could hardly lie down. And poor husband had got this hammock set up in the bedroom to see if that would be easier to spread the weight of her body. I don't know if it made any difference, and she couldn't even hardly get dressed because just the sensitivity of the skin with just putting on clothes was hard. And she was a very sociable person and used to go off for coffee meetings and mornings, and she couldn't do any of that. Anyway, her perfect place of relaxation was a beach, and a very specific beach. I think it was a beach she'd been to, and her healing colour was pink. She liked pink. So she wanted to change the pain from red to pink, and it needed to go from hot to warm, and needed to shrink. So the territory that it covered on her skin surface was to become smaller. And the texture was hard, and she chose it to go to misty. So this was all discussed in the preamble to the trance. So I wrote a few notes so I could remember. And she wanted a sun lounger on the beach and a sunshade. And I think when she got onto the beach first, she wanted to just go and dip her toes in the edge of the water. I mean, all very specific. And then to lie down on the sun lounger. And she could describe the colour of the cushion and the whole thing. And then I would just talk about noticing, now that you're really relaxing and feeling really calm and really strong and positive about yourself, you may just notice how that discomfort is changing from red. And I wonder what colour might be changing now to look like a little bit more pink than it was before. So you can't just say, right, it's going from red to pink, right, on to the next thing. It could be a little bit rambly and talking a lot and making it slow with lots of slow gaps in between so that person has time to think about it. And that was one that worked really well. She didn't come completely pain-free, but she did manage to get dressed and go out, and she was able to go off for her coffee mornings, and she could lie down in bed and she could put clothes on and all the rest of it. So that was very nice. Another one, you can talk about putting all these uncomfortable sensations into a box and then getting rid of the box. I haven't done this one, but I read about it. So you can think about, so take whatever image you have of the uncomfortable sensations and put them into a strong box, shut the lid, lock it, put this box into another box, lock the lid, put the second box into another lock. So you're really kind of isolating these uncomfortable sensations, is what we use the term. So now it's very secure. It's muffled, it's distant. You can hardly notice it now. And now you're going to send the box far away. And people have different ideas about how they want to dispose of the box. Hot air balloon, on a boat, into space, on a rocket. So those are quite nice ways to do it. And you can say, well, now you can picture it so far away, it's even easier to feel the comfort of each breath. So you're breathing in comfort and breathing any discomfort away on the breath. And now you can let yourself daydream about a happy time you would like to have. So they're now thinking of themselves in a future where they're completely comfortable and they're feeling really good about themselves. So instead of being a patient with pain, you're now optimistic about your future life. You can start having some good times. And I'd like you to take yourself to that happy time. So now they're visualizing themselves in the future, and let yourself feel free. So it's quite interesting how people completely get it. You know, you'd think it sounds so fanciful, and that normally we want to be much more scientific. But there's a whole huge field of creativity that we have ignored for most of our practice. Of course, some people can't imagine pictures or images. They're just not very good at that. And one patient I had couldn't get a picture. She couldn't picture herself in a garden or in a beach or anything, but she could consider a warm golden glow. So it was like a sensation rather than an image. And I would just pop her up on the examining couch and say, right now, just consider the lovely healing golden glow coming up from your feet and spreading all the way around to the top of your head, easing and soothing and comforting. So you can just use lots of descriptions. Music may work, or you can the patient can consider themselves swimming in healing waters. That water is like a magic water, a healing pool. Of course, if people have got a fear of water, that's not going to work. And a beach won't work if they don't like sand. So, and if they're allergic to butterflies or they're allergic to grass, a garden's not going to work. So that's why you have to kind of really thrash it out to begin with, where the perfect place is going to be. And for children, you can have, I mean, like we did with the magic glove, but you can also have magic cream. So the child with, bad eczema can have a magic cream that goes on and heals the skin. So there's a whole lot of stuff you can do, cooling. And I remember, I mean, it's not about pain, but there was a child who had very bad eczema, and for him it was really hot. And so his creative imagery was rolling around in snow. So in his little fantasy, he would take himself off to a snowy place somewhere and roll around in the snow, and that was very effective. Another lady who wasn't very good at thinking up a garden or something, she took herself off to a cloud. She could imagine herself floating in a cloud up in the sky. I mean, they're absolutely very productive when you let people come up with their own ideas. So if you're a healthcare professional, you want to learn, you can do it in 6 days, 3 modules over 6 days, very basic training. And if you want to do a more academic thing, you can go up to this course. It's mostly online, but there are days where you go there. So Birmingham City University, who do the training. And you get an academic qualification for that. So, oops, I think there was one more slide. Maybe I didn't do another slide. Nope, that's all right. Nope. Okay. So, anybody got any thoughts, or anybody want to? Everybody gone to sleep? They'd be all in trance. Yeah. Can I just add one more thing? Sarah runs an organisation called Transform, and if you look up Transform online, you'll see all the wonderful things that they do.
Well, thank you very much for making a little plug there,
Little
Maureen.
plug.
Thank
Yeah.
you.
Okay.
Yeah, I mean, they're designed basically for patients and healthcare professionals as well. As we all know, we're all a bit stressed at times. And those resources are lots of free ones just to download and learn self-hypnosis as well, because I tell you, I wouldn't have got through my career without using it for myself as well. But it saved me so much time for my patients, being able to be empowered themselves to help them through cancer treatment. So I think it's definitely a win-win. But thank you. And I mean, Maureen, I was going off into a trance there. That was lovely.
You're such a pushover. Yeah.
No, well, you have got that lovely voice that takes us all into that relaxed zone. So thank you.
People go to sleep in my company then. But yeah, so but you used self-hypnosis yourself for some procedure you had, didn't you, Sarah? You were telling me.
Oh yes. I actually because I had some medical students who were due to go into sort of different projects, and we set them up with a radiologist because they had lists that were quite adaptable to find patients to do some procedural work that they had to have done with interventional radiology, and then also to go through the MRI unit. And as I'm sure you'll plug also, BSCAH has done some really sort of interesting work trying to address MRI-related claustrophobia, which is another big issue. But if you could actually get patients to use hypnosis even before they even developed MRI claustrophobia, then that would be an asset. But I in the process of persuading this one radiologist who had to do some trigger finger injections for me, I had bilateral trigger fingers, and I've been through GP and the steroid injections, which hadn't been ultrasound guided, had not worked for very long. So this chap said, "Oh no, come and see me, and I'll avulse your sort of ganglia off your, your tendons with some local and we'll do it very precisely." I thought, oh God, this is going to be ghastly. I didn't enjoy the injections.
Very sensitive.
So I designed my own hypnosis and sort of about 23 minutes worth of self-hypnosis stuff that I listened to a few days before, thinking, well, it's going to be really embarrassing if I'm squealing and squirming on the end of his needle. So I've got to make this work. And thanks to hypnosis, I would say, not necessarily my own, but I was most incentivized to make it work, I have to say. Yeah. He said I was the first patient ever he'd had that hadn't winced and pulled my hand away from when the needle went in.
Oh, there you go.
On both sides. And actually, I was aware, and I just said, look, I'm going to put my ear pods in. Just you carry on, tell me what you want me to do. And I'm just going to be going off into my own little inner world here. And thankfully it was actually, it wasn't, I wouldn't say it wasn't uncomfortable, but the strange thing about hypnosis is you feel the sensations which are numbing and you're aware of things, but it wasn't bothering me. Yeah. So I was actually very much in a dual world. So it is a fascinating process, and I wouldn't say I'm the most hypno-suggestible person there is, but it's still very, very helpful.
Very good. Lovely. Yeah. Ranan, you want to?
Yes, thanks. Lovely talk, and hugely encouraging for those who accept it. But my question really is, what about a patient who has tried it and found it actually made things worse? Found that A, the lack of control was worrying, and B, the symptoms or discomforts got worse as a result of one go. How do you respond to that?
Well, not wishing, I mean, I don't know the patient or whatever, but what I found is that you've got to have the trust And you've got to be able to help people to really relax and get into it. I think if they felt there was no control, they hadn't been prepped properly, because you're in control all the way through, you're wide awake. You have to really give quite a big I mean, I didn't go into all that in this talk, so it wasn't long enough, but before you do anything, you've got to really prep the patient. So explain all the myths about, the stage hypnosis people. That's all just entertainment. None of that's real. You'll be in control the whole time. In fact, halfway through, if you're not feel comfortable, you can just get up and leave. You will be awake, and you'll be more aware of what's going on. So, it sounds like if somebody got worse, they didn't trust the therapist properly. They weren't on board with it properly. But you can never say 100% any of that.
Yeah, yeah.
But yeah, did you know somebody who that happened to?
I do, yes.
Oh.
I won't
Well.
go into details, but
No, but it's not. Yeah, of course that would put them off forever. Although somebody else might have been
it
able
has.
to. Yeah, it would do. Yeah. No, you've got to have a good personal rapport.
Yes.
Sarah.
Anyway, it sounds like a super methodology when it works.
Well, it is. And
Yeah.
I mean, I love the thing with the magic glove. I mean, why would so many children? And I mean, when I did pediatrics, you had to literally hold them down and they were screaming.
Oh, yes,
And
yeah,
you don't
yeah.
have to do that. And yet, what's so frustrating is people they don't believe you. Oh, yeah, that's a load of rubbish. And that, even though they not really looking that hard, I think the stage hypnosis has kind of ruined the reputation of clinical hypnosis. But anyway, Sarah, you wanted to add to that or say something?
Well, I was just saying that, I mean, I thankfully haven't had anybody who said they felt worse. We ran a service at Charing Cross, and the vast majority of people who ever came, and they could have self-referred or referred in for a variety of issues. The worst that we ever got is it didn't work for me. They went along with it, but they didn't feel it worked.
No.
Or made a significant difference. And I think, the other side of the coin is that a lot of the time there's that. I think the key thing is having that sense of lack of control is what you absolutely want to avoid when you go and do hypnosis with somebody, because you're not really doing it to them, you're doing it with them. And I very much emphasize that all hypnosis is effectively self-hypnosis. It's a very permissive, suggestive, therapy that actually you're empowering patients from the off, from the point at which, Maureen was saying, they design the therapy you're giving, before you're doing it, which is all part of the process. And I think that perhaps that sort of, there might have been some sort of, I don't know, in this your friend, but perhaps a negative anxiety built up about it. But I think the majority of the cases, it's the worst is it just didn't help. But there are about 10% of the population for whom we have to acknowledge their brains are working in a different way. They don't engage with that sort of metaphor, whether it's auditory or kinesthetic or visual, and then you have to try a different strategy.
I think about 5% of people are very hypnotizable, and there are the other lot at the other end that aren't very, 5 to 10% you can't really do much with. But the whole of the other lot in between are hypnotizable to a level that is clinically useful, I think one would say. You can get good and you can get some average results, and you can get some really good ones. If you get a really good one, it's really very nice, very satisfying.
Yeah. No, I've certainly had some, amazing transformative cases myself, really. One poor fellow he had the most excruciating pain. He was sort of lying in a fetal position in a darkened room with an appalling tumour wrapped around his occipital sort of region and parapharyngeal nerves, and even sort of light was irritating and overstimulating. So when I first met him, as well as hopefully giving him some chemotherapy to address his cancer, we were talking about how he could perhaps use some of the mind-body techniques such as hypnosis to try and help his pain while he was waiting for the effects of the treatment to work, and that could actually help the treatment work perhaps. And we were just talking about what he liked doing, and he was very much into space, and he had a telescope, and it was as you said at the very beginning, people give you their metaphors, their pathway through their treatment. And he has absolutely run with that metaphor, as we sort of talked about how he could actually go up through his, the more he could see himself looking through his telescope, he was going up into space, and he would find that space within. And that word space then took on a whole sort of different metaphorical power to help him manage his pain. And he has done extraordinarily well, and now very much is handling his journey, which has so far been really, really good. But he's had so many problems on the way. But he uses the hypnosis very regularly, and I think it's allowed him to come off seriously big doses of painkillers, which weren't being very helpful for the type of pain he had. So
and he would have been really motivated. I mean, that's the thing, they're very focused because there's nothing much else to think about than this excruciating pain. Can I just say, Ian, did you want to speak? I think you've sent a message on chat saying you couldn't find how to raise your hand, but if you go to react, the little heart-shaped thing, you've got options. Anyway, it doesn't matter. If you want to just say something now. You're muted. I think you have. Oh, there you go.
Oh, does that work?
Yeah, we're on.
Okay, you're on. All right.
Well, you're on.
I haven't done Zoom, Maureen, for a couple of years.
Oh no, I know it's a nightmare.
Out of the NHS. Anyway, what I noticed as well as your language, which the psychiatrist Ian McGilchrist talks a lot about.
Oh yeah.
In terms of metaphorical language being very different in the brain from direct commandments, which I was used to delivering in orthopedics. But what I noticed particularly was that the nurse or the therapist working with that girl, and her gestures and touch as well as language.
Yeah.
And the prasadi, or the wave-like speech pattern that she used.
Yes.
And repetition.
Yeah.
And I remember being a patient myself, terrified, getting a personal vasectomy, and the surgeon was called Mr. Fock, believe it or not. Anyway, I was terrified, but the way the nurse touched me and just a few words made a magic transformation in going into anesthetic.
Yeah, it's fascinating.
And
just a bit of humanity, a bit of gentle.
But it's quite a rare commodity, which is
shouldn't be, should it? Absolutely.
No, but
it's
quite rare.
Well, let's try and turn that round a bit.
Yeah, more poetry and touch, I would say.
Yeah. But it's fun. It was very interesting with that magic glove, I think, and you can do it with adults, but you wouldn't do it quite the same way. But you can get them to imagine dipping their hand into an ice bucket or something and then transferring the numbness to the mouth or wherever. I think dentists.
I think you should get a massage therapist or a body therapist sometime, because they often intuitively do this in therapy.
Okay.
But that's my observation.
Yeah, no, that's good. Anyone else got a case or an idea? Question?
Just a question. Does hypnosis have to be done one-to-one with the therapist physically present with the patient, or can it be done? Can it be done remotely, online, so to speak?
Yeah, it can. Yes. Well, during lockdown, a lot of therapy went online. I mean, you either got it online or you didn't get any. And yeah, you can do hypnosis training online and get people to practice with one another online. Yes, no, it works surprisingly well. And I think you've done some, haven't you, Sarah? Did you do some online?
Yeah, no, I've done quite a bit now. And I think, as you said, when we were sort of forced to do everything online, there was a sort of slight disquiet. But actually, as long as you've got engagement, and it's just, I suppose, from the point of view of being the therapist, it's quite helpful to be able to have that line of sight of your patient in trance, because you can still pick up on the signs that they are, in a trance, and obviously get that feedback just visually, even though they're not saying anything a lot of the time. They can, of course, but most people aren't terribly chatty whilst they're in deep trance, unless you ask them to be. But yeah, I mean, I've had perfectly good feedback, and actually, it's sometimes easier to record the session, in that way as well, and then send that to the patient for repetition, because I think the other key thing about hypnosis is that the more you can repeat and do that self-hypnosis process afterwards, which is why I think there's so much repetition within any framework as well, because that repetition is so important in embedding it and getting the patient used to being able to access that deep hypnotic state where they can be sort of perhaps enhancing that communication with their subconscious self. But I think that process for us all is actually incredibly empowering. And to be able to reprogram your emotional responses can be very freeing, especially when you know that there are very, very distinct triggers for an emotional reaction you don't really find is going to be helpful.
But I used to quite like teaching people, when they were in their garden and they're really relaxed, they feel really at ease with themselves, and then say you can recreate this lovely sensation whenever you touch your fingertips and thumbs together. And a lot of people said they could just do that, when they were out and about. And the more they did it, and the more they did it on their own in their own self-hypnosis, the more powerful it became. You could almost switch off a panic attack if you did it enough. I mean, nothing always works all the time, but if you've got something you can use, it's nice. We're just going to mention a patient I didn't mention was a man who had horrible sciatica, and his visual of because he knew about the nerves and all the rest of it, and he said his visual of his sciatic nerve pain was lots of wires, like electrical wires, that were all tangled up. They were coming out of his back and down his leg, and some of the insulation had worn off, and they were sparking against one another. And I thought, that does sound painful. And so I said, I'm wondering what would need to happen for that to improve. And have you ever had a pain that you managed to deal with in the past? And he said that he'd had a leg ulcer some years before, and the nurse would come and dress the leg once a week, and she would use this very nice piece of cotton wool and just bathe the ulcer, and that was very soothing and eased the pain a lot. Anyway, so I said, okay, so let's do that. So in the trance, I got him to a nice relaxed place. I think his preferred place to be was on a river, but I can't remember exactly. Anyway, and I said, now just consider there's some cotton wool soaked in the healing liquid, just stroking the wires all the way down your leg. And he said, as the wires untangled, the insulation repaired itself quite magically, and slowly the pain eased up. It took a while because he was in a lot of pain, but he repeated. He was quite good. He gave him a recording, and he was determined. But again, I think he was not a hard hypnotic subject. He was quite good at that stuff. But I was just fascinated by how elaborate people's ideas were. They just came up with a whole load of stuff.
Maureen, can I ask you a question?
Yeah.
And thanks a lot. That was really interesting. I don't know much, but I've done the course that you run at the BSCAH. But I haven't really practiced it. I was just interested in this idea of hypnotic regression. Can you say anything about that?
What, going back in time?
Yeah, I mean, from what I've read, this idea of people who've had like sort of past traumatic events in their life that haven't been processed and hypnotic regression,
Oh yeah.
you take them back to that event and it's like reprocessing the event. I just wondered what
Yeah.
your what,
Well, I have to
what,
say, I haven't done a huge amount of that. I mean, a lot of what I did with hypnosis wasn't that sort of therapeutic, psychotherapy. I didn't feel equipped enough, but I do know about
yeah,
what people would do. And Sarah might correct me, but I think what you do, you get the patient into a nice relaxed state, all the usual preliminaries, and then they think of their life as a line. So you've got a line going out ahead of you, which is into your future, and you've got a line going back, which is into your past. And you get them to imagine themselves going up above the line, right? So they're not in the experiences, they're above and they're observing. And you just say, now just allow yourself to drift back over the time, might say weeks or years or something, until you come to the place where you think something triggered off your unhappiness or something happened to you. Um, and you might not want to go down into that because that could re-traumatize you, but you could send reassurance and comforting messages to the child self who suffered something or whatnot. So that's a very poorly explained
yes, yeah,
way of dealing with it, but you can revisit those things. And sometimes people are prepared to go down and give their child self a big hug and reassurance and say, you did the best you could because you were only 5 or whatever it was. So timeline, I think that's called timeline.
right. Oh,
And then you bring them back
yeah, yeah,
and go
great.
back.
I mean, the only other thing with reference to that, if I could just add to some of the techniques that I've used for claustrophobic patients, because head and neck radiotherapy is my business, and so a lot of patients have chronic claustrophobia and having to wear a mask to fix them onto the radiotherapy couch. And I've had 1 or 2 extraordinary cases where I mean, most claustrophobes can absolutely pin down how they got claustrophobia really clearly. Most phobics will tell you exactly what triggers their phobia and when that started. And I mean, the interesting thing is obviously we tend to the more permissive hypnotherapists among us tend to like to do the relaxation response. But I can tell you that one of my least relaxed patients was absolutely rigid throughout all of the hypnosis induction that I was trying to do. And he had been a little boy stuck. Well, he'd been playing hide and seek when he was about 5 with his slightly older brother and his friends. And they'd been up in the loft. And he jumped into this nice big trunk, which was an excellent place to hide. And his brother was nearby, but the friends found his brother and they all ran off. And when they couldn't find him, they just moved on and did something else. But when he tried to get out of the trunk, he found the latch had come down and he couldn't get out of this trunk. And the poor little fellow was stuck in this trunk for about 4.5 hours or something until he was actually found. And then I think some short time later, he watched that black and white film, The Man in the Iron Mask or something. I'm sure we all saw it when we were kids or whatever. And that embedded his claustrophobia big time. And he was fine. He managed to get through life until he got a small larynx cancer, which was very high cure rates of radiotherapy. But he could not get in this mask. And I was finally called in once he'd been back and forth and dosed up to the eyeballs with ever increasing amounts of sedation, which never worked sufficient for his mask to be made. And he was willing to try anything. And I basically sort of took him back, sort of as far as I was trying to relax him. I just thought, well, he was lying there with his hands in a claw, rigid claws on the couch. He wouldn't close his eyes because the poor fellow, I suppose in retrospect, has been stuck in a trunk aged 5 and it was all dark. And the last thing he wanted to do was not see light, and be shut in, even in behind his eyelids. So you just go with the flow. But I remember sort of taking him through that period and back. Once I thought he was as relaxed as I was going to be able to get him, back across that period and back before into the very, very safe space, that dark, close space of love and nurturing, which is his mother's womb, and sort of then from that place actually allowed him to let go of all of that trauma, which I did with metaphorical balloons going off into the sky. And in the end, I sort of kept him in trance, walked him through to the simulator, and actually he managed to go and have his mask made. We'd rehearsed all of this beforehand, and I'd sort of reference checked all of this strategy with him. He sailed through his radiotherapy after that. But I have to say, he didn't fulfill on any of the relaxation feedback I thought he needed to be. But,
so you kept him in trance during the mask fitting?
Yes. Yeah, so I thought, well, he's, the lovely thing about hypnosis is you can ask people to just get up and walk, and I've done that once before very successfully. And that worked very well for him. And then you embed on that particular type of therapeutic environment, you then your post-hypnotic suggestions are now, to reformat and reframe what that mask means to the patient. So, he's now held snug like he was in the womb, in something that was going to keep him safe and positioned just correctly, so that the therapy, the healing, and the melting down of his larynx cancer was going to go by very quickly and smoothly, whilst he was just snug in this mask, which was just going to be nurturing his recovery. And so you then basically remodel all of those things that were fearful into something that embodies the relaxation that you hope he can build on as he goes through the treatment. And
brilliant.
So that has worked quite well for claustrophobes, referencing back to something that, of all the memories that you've had, it's like you were talking about putting things in the box. I think we, as part of that particular process, it was all about looking, from a perspective of a great distance, so without any emotional engagement of that little boy's experience, and putting that experience in a box back into a safe space, so far away on the shelf of your memories, and all of the attached balloons of terrible emotional angst that went on associated with those particular events can be detached, and you get them to undo the bow and let those balloons go off, so that they don't have to have the hold on you ever again. So I think it's amazing what you can do with those metaphors.
You can be quite creative.
He was a great success. Yes.
Mary, you want to say something?
Yeah, I was just I did the BSCAH course at Birmingham just on the cusp of COVID, actually, just as COVID broke out. So it was in person, and they were talking a lot about metaphor and also about eye movements, and thinking of your comment, Nicholas, about processing trauma. And I said, is this like EMDR? And I was told, no, it's definitely not. It's completely different. And then a few years later, I qualified as an EMDR therapist. For those who don't know, I'm a psychotherapist. I'm not a pain doctor. And there's a lot of similarity. In terms of the relaxation and so on.
Imagery.
And imagery, all of that. So there's a lot. And in terms of reprocessing trauma, the timeline is one method, but just to give a plug for EMDR, because it works really, really well and doesn't require the person to rehash the trauma and talk much about it. In fact, there is a way of doing it where the therapist doesn't even know what the trauma is. They don't even have to tell you. They just have to know it in their head, and you do the processing, but all they have to tell you is if there a change or no change. So for people who worry about control, and I have a patient in a hospital I work at who she said, I know you're not brainwashing me, but I'm worried that you're going to brainwash me. But I know you won't, because, and she's very, I'm like, I'm not going to brainwash you. I couldn't if I tried. I know. So we have just begun doing the whole EMDR protocol where she doesn't have to tell me what the trauma is. She doesn't have to tell me what she's noticing in her body as we process it. She doesn't have to tell me anything. All she has to do is say, is there a change or not a change as we process? And that puts the control completely back on her. So
what did she present with? What was her initial reason for complaining of something? What was she saying?
Oh, it's very complex. She's inpatient in a mental health, long-term mental health rehab with personality disorder and chronic pain, lots and lots of chronic pain. She takes quite a lot of Oromorph. It's meant to be PRM, but it's not. It's just her standard medication 2 or 3 times a day. So a lot of that is about control. She's had a lot of trauma in her life. So the processing is all on her. I just step back and wave my finger and help her get to a relaxed place. So control is a big part of it. And just to say, there is, whatever they tell you, if you go to Birmingham, there is a lot of crossover with EMDR and clinical hypnosis.
Well, I think EMDR came out of hypnosis.
Yeah.
The woman who went off and developed it, Francine Shapiro, I think, wasn't it?
Yes.
She asked permission from the Hypno Universe people who she'd been working with. Did they mind if she went off and developed this new way of doing stuff? And they all said, no, off you go. So definitely has got hypnotic. Do people know what EMDR is? I'm not sure everybody knows what that is. People have a rough idea. Eye movement desensitization reprocess. So it's mainly about trauma, isn't it? Getting rid of
trauma and phobias.
And mistaken beliefs kind of concepts, getting rid of that stuff. So it's I did a little bit of EMDR, 1 or 2 patients, but I wouldn't say I was an expert. But it's quite expensive to train, isn't it? It's thousands, isn't it now?
It's a couple of grand.
Yeah.
It's tax deductible.
Well, thank God for that. I did one about 10 years ago. I did a little EMDR. It was 150 quid. It was, but you get the basics. It's not that.
Can I just ask, with the EMDR, it sounds ideal for patients who obviously have irrefutable misconceptions, if you like, from the point of view of the hypnosis side. But is it because I always thought you had to have them reconnect with the trauma. So is that because you're blending a hypnotic way of evaluating or taking them through the process, and because you've obviously trained in the hypnosis side as well, and adapting that for the patient? Because it sounded to me like it was slightly a bit more like flooding in a CBT setting where you're taking somebody through it, but then making them do a different set of eye movements that obviously are perhaps a dissociative, neurological reframing on one level as well. I don't know whether you could just expand on that for my education as well.
I think there is a lot of, patting your head and rubbing your stomach and trying to think of that there is some kind of distraction element to it as well. But it focuses more on the somatic symptoms they get when they think of the trauma rather than going into the trauma itself. You don't have to rehash it and retell it and re-traumatize yourself. And in the blind to therapist protocol, they don't even have to tell you what the trauma is. They just have to hold it in their head. So there is some reconnecting with it, but they don't have to rehash it. They can manage it. The assumption is that it's in their head all the time because it's making their life dysfunctional. So it's not like we're putting something there or pulling off a scab because it's there bothering them all the time. They just don't necessarily have to tell us about it. They just have to tell us what's happening in their body. But with the blind to therapist protocol, they don't even have to tell you what's happening in their body. They just have to say
it's really good,
changing or it's not changing.
Yeah, that sounds much gentler. Yeah.
Christos, did you have your hand up earlier on? I don't know if you wanted to say something.
Yeah, I was just going to mention that I also just funded an EMDR training, and this one is quite good, and I think it's something like 900 something for the 40+ plus and hours, then you can keep auditing. So you can keep attending for free, basically, for a long time.
Sorry, what is that one?
It's a guy called Rick Levinson.
Oh, you put up the thing in the chat.
Yes, they give, I think, he's very good, and it's a nice group. They also do for children and so on, and they some of his associates, I think, also do quite a lot of hypnosis work, so hypnotherapy work. So
you're using it for pain, or?
I haven't used it that much. I've used it a little bit for trauma, but then all my patients are quite traumatized. So this works more for people who have a more or less intact character structure and just have, specific traumatic experiences.
Okay.
But it can offer help. I mean, some sort of help. It doesn't go nowhere. Of course, if you offer someone something and then, even if they're not transformed by it straight away, then it still goes towards their resources of, potentially good things happening if done the wrong way and not something that, they will then disparage and blah, blah, blah. So yeah. So there's
good.
Anyway, I just brought it up because you mentioned the cost, and it was reasonably good for people that actually maybe I don't know if it's for people that work for public health or something like that, but I mean not too much more for the others either. So yeah.
Right. But there's always something else to learn, isn't there? I mean, there's so much. You just never stop, seems to me.
Yeah.
If you're practicing, you just keep on learning, reading new things. It's really good.
Well, the thing that I really liked is this really lovely psychologist says, I keep learning, and that he would keep learning from his patients. And I think that's a big so
huge.
So thank you.
Absolutely. Yeah, no, thank you. Right. Well, we've got a few more minutes, but people have kind of run out of ideas. Anybody got an idea what they would have? Say, for instance, you were going into a nice relaxed state. How many people would want a garden or a beach? I mean, it's very particular, isn't it?
Yeah.
What would you have? Garden?
Definitely garden. Yeah.
Garden. Yeah. You can have I used to do one with people with a lot of anxiety, and they would want a garden, but to make them get into the garden, I would make them walk along a path and getting more and more relaxed, like a deepening already. And then they go through a gate and they're in the garden. They go down some steps onto the grass, and they're getting more and more. And there would be a stream at the far end of the garden, and all the old worries and stresses would just wash away down into the crystal clear water. And those seem to work for some people. They can people come up with, they want water in the garden, or they want breezes blowing, or the sound of the trees. It's all very Ranan. Yeah.
Yes, I think my actual relaxation place is the bath. I love being in a nice warm bath, and I can imagine being in a permanent or very long-term nice warm bath, just thinking along my thoughts and feeling extremely relaxed.
You'd have to have it continually being warmed. I mean, you wouldn't want to get it.
Oh, yes. And indeed, when I was doing my finals, I remember actually practicing for them in the UCL building itself, because my flat didn't have a bathroom. And I kept the hot water going at such a rate that the bath stayed warm while I was doing my revision.
Right. You cleverly
That's where it all stemmed.
Probably ran this bill up to some fantastic level.
You must have been a complete prune by the time you
I did get what they call used to call washerwoman's fingers and toes and so on, but
you passed.
I did actually pass, yes.
Oh, well, it's all worth it. Absolutely. Yeah.
So,
So an anecdote.
Yeah, lovely.
I was going to say, Sarah, are you at Charing Cross Hospital then?
Yes, that's where I'm based at the moment. Yeah.
because we used to have a hypnotherapist when I worked there. I was Dr. Nixon's husband in 1979, and there was a Dr. Thomas.
Wow.
Yeah, Dr. Thomas used to come in and hypnotize the patients, and I completely
Oh,
blew it
wow.
because I had the cardiac arrest bleep on me, and I went into one of the sessions with the patients, and the cardiac arrest bleep went off. He was really upset with me.
Oh.
Yeah, that wouldn't go down
Well,
well.
needs must. You had to answer the call. Yeah, like that.
Life interferes.
Oh.
What you have to say is that there may be some, because I practiced my hypnosis in a very busy practice. There were people running up and down the corridor, phones ringing, babies crying, and I used to have to put in the suggestion, you may notice some sounds in the background, but you don't have to take any notice of those at all. Everything will be fine.
Yeah.
And that was all right. That worked up to a point. But yeah, if you had a cardiac arrest bleep going off, that might override that suggestion.
Yeah. I mean, as I said, was he trying to hypnotize you?
No, he was. Did
He
you
was
hear?
doing it for a patient.
I don't know if you remember, well, we've heard of Dr. Nixon. He was the very controversial cardiologist at Charing Cross in the 70s. So he was the inventor of the sleep and rest regime. Have you heard of that?
Oh, no, I haven't. No.
Oh, well, Google it one day. It's fascinating. I was his houseman, and he used to.
Oh, wow.
He went very, very alternative, and he believed that cardiac ischemic heart disease was due to stress. So the patients, he had this 2-week sleep and rest regime where he used to admit the patients into 11 South and
Oh my God.
dose them up with drugs and put them to sleep for 2 weeks.
Oh my heavens, right. Oh.
Yeah, he was very controversial. Look him up. He was a fascinating man.
You didn't then pass them off to the pulmonary emboli clinic then?
No.
Could backfire badly, couldn't it?
No, they didn't actually. It was a fascinating idea.
Interesting, isn't it? No, well, I mean, the fascinating thing about hypnosis in the hospital setting is all the studies have shown that actually it saves bedtime. Ultimately, if you have it on the back of surgery, people recover quicker, get out of hospital quicker, use less drugs. The anaesthetists are really catching on fast now. I mean, sadly, though, I think within the NHS, we still need to sort of win over some hearts and minds in the management, really, because I think that the message hasn't quite got through. But if for all its huge adaptability, within any specialty, I think it could have real cost savings if we could only sort of implement it within pathways. But I think the challenge is actually winning over both clinicians and patients, and then allowing the patients to access the framework which they can use it in, which is where I think we need to go that extra level now that we've been forced into the digitization of medicine and the remote potential for medicine, how we can use that to enable patients to sort of help themselves with these sorts of tools is the next level up, really. But yeah, no, it's fascinating when you get somebody who's obviously made it their own in their own sector. Clearly we sort of know, I suppose, from a new perspective that stress modification is incredibly important for cardiovascular disease, I'm sure, because the whole sort of stress axis, cortisol and all of those sorts of chronic stresses will definitely have an impact on cardiovascular disease. But now I suppose we dilute those findings with the fact that lifestyle medicine means that most people are better when they keep moving more. And now we have a population who's not moving very much. And often when you're in pain, you're not moving very much. So, yeah.
Just going to add to that. Somebody has done a study on macaques, the primates, and they've put them in, so it's quite controlled. So they've put the macaques into stressful social situations and then not stressful social situations. And then they look at the alpha males. And if the alpha males are constantly being attacked by the young pretenders, the young rivals, they've looked at their coronary arteries, and they get clogged up coronary arteries far faster than the other macaques in the troop. And also their fibrinogen levels are higher because they're getting bitten all the time. So you have to clot. You have to have good clotting, so they're more likely to have cardiovascular disease. And that because you can't really.
Well, I suppose fibrinogen is fibrinogen
makes you clot.
Sorry,
factor 9 or something. Yeah, so they
well, I think it's also, we see very high fibrinogens in an inflammatory setting, don't we, with cancers as well. So when you have hyper-inflammatory conditions,
I mean, whether
but it is sort of like a secondary marker. But yeah.
Sorry,
Don't you
Peter.
think it's a bit?
Sorry.
I was just going to suggest, I was going to say that my special place might be the view from Rydal Hall, which
Rydal
we all
Hall,
share.
Yes.
If you haven't been there already,
Gazing into the distance. Yes, well,
absolutely.
Yes, guys, I've booked next year, so you're all invited.
Yeah.
So 5th of
definitely on for that. Yes.
First week in July, 6th. Well, it's the Monday to the Wednesday, and it's going to be politics, economics, and pain in a fairly broad sense.
Yeah.
And I've managed to get. Has anybody read The Spirit Level by Professor Richard Wilkinson? No.
I've heard of it.
Better all go and read the thing then. Anyway, so he's coming, and it's all about inequality and disability, and all the adversity of life comes from inequality. That in societies where there's a wide gap between rich and poor, you get far more illness and crime and drug addiction, all that stuff. Anyway, so that's going on. Peter, sorry, are you waving your hand again?
No, I was just scratching my head.
Sorry. Okay. Nicholas, did you come in there?
Just saying, this thing about movement, it's a bit of a myth, isn't it? I mean, if you look at all the statistics at manual workers and scaffolders, they all drop down at 50, even when you take smoking and all their bad habits. So I think this is a huge myth that exercise is good for you.
Oh, no.
You look at it, think about it. It's a complete myth. It's people with money, middle class people who can afford to go to the gym and exercise. People who do real exercise will drop down dead by the age of 50 because they're exhausted.
Well, I don't know, maybe it's because they're being builders and in a lower socioeconomic group, and they go to the pub and drink too much as well and smoke.
But all the research, you look at all the research, that's taken into consideration. They're all exhausted, they're knackered.
Well, I think there's a really interesting one. I'll push back on that another bit, because there was an exciting study from the lifestyle folk who had a huge number of colorectal patients who were randomized into just a standard chemotherapy, adjuvant chemotherapy, and they either had to do a certain little routine of exercises or not, and that was the two arms. And the patients who did the exercises had a statistically very significant indeed survival advantage.
Oh yeah,
so actually, the longevity studies would also sort of say we have to keep moving. That is so important.
Well, I'm a member of BASM, the British Association for Sports and Exercise. There's masses of information about exercise and health, but I would definitely question it. I think a lot of it is.
Oh, okay.
It's massive. I've been a member of BASM for years, and they have a whole section on how good exercise is. But actually, when you look at it again, a lot of it is it's a bit mythical. Actually,
probably depends on how much you enjoy it or not.
Yeah, and there's
you're spot on. I think it's doing the stuff you like, I suppose.
There's so many other factors, but I think just getting people exercise for their health can be very dangerous. You're better.
I think you're. I suppose there's moving and exercise, and as I say, I would hate to go if I was forced to go for a run every day. I would really hate that. I don't think that would probably do me much good. But if you made me do qigong or yoga or something like that on my terms, then that would be a different matter. So I think you're probably absolutely right. It's about keeping moving in a way that gives you pleasure and joy and relaxes you, So I think it is maybe not. And as for most medicine and life, there's never a one size fits all, really, is there?
Didn't the guy who invented jogging, what was his name? He dropped dead.
Oh, yeah, he dropped dead.
Out on the jog.
The HIIT studies, the high intensity exercise, and going mad for 3 minutes, they have quite, if you go into that too regularly, then there's a few, heavy mortality peaks there.
It can get silly.
Yeah.
Okay, guys. Well, I think we've come to.
Thank you, Maureen.
We've slowly slid into the end of this meetup. Anyway, it's been lovely to see you and all nice chat.
Just one thing before you go, Ranan. It's good to see you again after quite a long time. I haven't, but I wonder if you'd consider giving a webinar yourself sometime sometime
yes.
in the new year.
Oh, I don't think so, though. Thank you very much.
Of a topic of your own choosing.
I'm cutting down. I'm getting old and cutting down on doing things, you know. But I thought this particular one with Maureen presenting, I was quite keen to hear her. But thank you for the idea. But
well, if you change your mind, send me an email.
That's very nice of you. Thank you. And,
very good to hear about your stuff. Okay, guys, that's it.
And thank you very much.
Very much.
Thank you. Thanks, everybody.
Thank you, Maureen. Brilliant.
Bye, guys.
Thank you.
Cheerio. Bye then.
Bye-bye.
Yeah.